Hello and welcome back for another edition of Safe and Sound. I'm your host Doug Bolnick from the St. Charles County Department of Community Health and the Environment. On today's program, we're discovering programs designed to extend learning, protect health, and improve our community. The St. Charles City County Library District's Ready to Read program brings mini libraries to partnering organizations throughout our community and extends opportunities to increase literacy. To provide more information on this outreach project, Executive Director for the Library Foundation, Kristen Williams, will join me in the studio. In addition to a hunger for knowledge, some children in our community struggle to find a nutritious meal outside of school. Operation Backpack can help. Regular hand washing will help prevent the spread of disease and foodborne illnesses, but there is a proper way to wash your hands. St. Charles County Health Educator Brittany Schulte-Heinrich will show us how. Next, you may have heard of the disease tuberculosis, but do you know much about it? Communicable disease nurse Shelley Reynolds will point out why we should be concerned about tuberculosis and clarify the differences between latent and active TB. The Community Council of St. Charles County's Continuum of Care works to help individuals in need. I'll visit with Dottie Castiger to learn how, with your help, the coalition assists fragile families. Lastly, kitchen fires can be dangerous. Steve Brown from Central County Fire Protection offers tips for preventing them and other dangers within your home. Let's start by learning more from Kristen Williams about the Library District's Ready to Read program. Kristen, welcome to Safe and Sound.
Thank you, Doug.
Could you tell us a little bit about the St. Charles City County Library District? There's a lot going on that people may not know about.
Yes, we are a district that serves the entire county of St. Charles, and we do that through 12 branches. So we have smaller branches in the outskirts of the community. So up in North County, we have a location in Portage de Sioux, as well as in South County, we've got a great little library in Augusta and in New Melle. And then we've got some general purpose branches throughout the region, as well as some of our larger regional branches.
You have a Ready to Read program. Can you talk about that, like who's it for, where you can find it, that kind of thing?
Yep, so the Ready to Read program is a program supported through the Library Foundation that really focuses on early literacy, and we do that by providing books and resources to parents and caregivers of pre-readers, and we do that with early literacy kits. So every new mom that delivers in St. Charles County gets an early literacy kit that includes 3 books as well as materials about what they can do to prepare their child to be ready to read when they get to school, as well as we offer mini libraries. Our goal is to get those resources outside the branches of the library and into the community where people need it most.
So obviously, literacy is very important. It affects what you do the rest of your life. And if an organization wanted to become a mini library or wanted to participate in the program, how could they do that? And are there requirements for them?
So what a mini library is really just a cute little bookshelf that that holds not only books but interactive activities that parents and children can do together, as well as a cute little table and chairs for the kids to sit down in. And our goal is to provide these mini libraries in locations where parents with small children will be waiting for a significant or even just a short period of time. And so right now they're in locations like Volunteers in Medicine, Connections to Success, WIC has one, and we are hoping to get to those families that could use the resources a little bit more so that the kids, as they're there, they can take a book home, and we want them to keep the book because we know that access to books in the home is one of the key indicators of success for reading down the road.
So I'm assuming that you'll probably need some help in doing all of that work. If somebody wanted to volunteer their time or even donate to help the program, how could they do that?
And there's a lot of different ways that they could actually help. If they are a location that would like to have a mini library, we would love to talk to them. Currently we have 25 libraries out in the community, and so they could contact me through the foundation. A simple email is foundation@stchlibrary.org. We are looking for volunteers to help maintain that, and we'll also get them involved in some of the other Ready to Read aspects of the program. And obviously donations are always accepted because even though we want to make sure that people can get the books for free, they're not free, and so they do cost money, and sponsorships and donations would be greatly appreciated.
Well, thanks for coming in. This is a great program, and I'm glad that you offered to give us a little bit more information about it.
Well, thanks for having me, Doug.
While improving their minds through reading, school children also need healthy meals to feed their growing bodies. Operation Backpack was formed to ensure that kids have nutritious foods outside of school.
Operation Backpack is a child-focused hunger relief program. 7 years ago, we had phone calls coming in from administrators, teachers at school, telling us that children were arriving at school, asking the teacher if she had any food in her desk, going down to the cafeteria and ask if they had any extra food they could eat, and just reporting to the teachers and the counselors at the school that they hadn't had dinner before. They might not have eaten very much over the weekend. So they called asking, is there something that we could do? It started 7 years ago with 100 children in one school, and it has grown now. We're serving 5,000 children during the coming school year at about 70 different schools throughout the region. The program benefits children who are most at risk of hunger. And what we know is that a lot of times children living in low-income families get the benefit of the school meal program, so they get breakfast and lunch, but then they go home and there may be no dinner. On the weekends, there may be very little, sometimes no food in the house. So Operation Backpack is really a bridge of nutrition from Friday until Monday, so that these children who might not otherwise have enough food have plenty to eat. As you can imagine, distributing 5,000 backpacks every single week is no easy task. And we have someone on our staff who directs the program, overseeing that the bags are packed each week and then delivered to the schools. We have great groups of volunteers that come in on a regular basis. And we also have a lot of corporations, schools, churches, and even some individuals who come in and pack up the backpacks. And during the entire 7 years that we've had the program, we never once had a problem getting volunteers to come in and pack those bags. People just, really can understand the difficulty of a child not having enough to eat. It's a program that resonates with people, and fortunately, our volunteer support is very strong. And financial support is, of course, always a challenge. These backpacks cost about $5 each week for the children, and they contain 2 protein items like soups, stews, canned ravioli, also a can of fruit, a can of vegetables, some cereal, shelf-stable milk, and a sweet and salty snack. So it's just enough, that the child can carry it home. It's not too much weight, although, they weigh between 5 and 6 pounds. Schools that are interested in participating in the program may call Operation Food Search, and we ask that all of the parents sign a release acknowledging that their child may participate in the program. Anyone wanting to volunteer also to call Operation Food Search, and we can arrange a time for organizations or groups to come in and pack these bags. We pack 5,000 each week, so it's a massive effort, and we certainly need a number of volunteers to help with that task. And monetary donations, of course, secure the success of this program. And we accept those donations for the backpack program exclusively, or for some of our other programs. And for every $5, it provides a backpack to one child for a week. Some people are very generous and provide backpacks to the whole classroom for the week, and some even the whole school for a week. And even beyond that, some corporations and foundations are doing this and are supporting entire schools for the semester, or sometimes even longer. But donations, both large and small, are always welcome.
Improving our children is definitely a community-wide project. Stay tuned after this break to learn about other programs that help our community.
Can you help me with this? My new dad teaches me all kinds of stuff.
Sure.
He helps me with homework.
That would be 3.6795.
Thanks.
Yep.
He helps me with my decision making.
I wouldn't use this one. Ever.
And he's even teaching me how to drive.
And that's why cars have bumpers.
I'm learning so much.
You don't have to be perfect to be a perfect parent. Thousands of kids in foster care will take you just as you are.
Welcome back to this edition of Safe and Sound, where we're learning about programs that are making St. Charles County better. To make an impact on your community, it's good to be healthy and disease-free. St. Charles County health educator Brittany Schulte-Heinrich explains how proper hand washing can do just that.
The St. Charles County Health Department has a variety of programs that focus on the prevention of communicable diseases. One of our most popular programs is Germs Are Not for Sharing. This is a program that works with preschool students all the way up through 5th grade. It's developmentally appropriate. It covers the basics of proper hand washing. For preschool, kindergarten, 1st and 2nd grade, we go in and explain exactly what germs are and how germs can get into our body and make us sick. We do have a book that we use along with the program. It's called Those Mean, Nasty, Dirty, Downright Disgusting, but Invisible Germs. The children really seem to enjoy it. After that, we demonstrate what proper hand washing is from start to finish. We use a glow germ, which we spread around the room to the students. We turn off the lights and use a black light to show them how easily one person who comes into a classroom who doesn't cover coughs and sneezes the right way, who doesn't wash their hands, can spread a whole lot of germs to their friends. So once they see how their germs glow, we go to the sinks and have them practice those proper hand washing skills, and we will return back to the classroom to show whether or not the hand washing techniques they used were effective in getting rid of all of our glow germ. This program is really popular in our daycare centers as well as in our elementary schools. Ideally, we should have a class size around 20 students or less. If somebody was interested in registering for one of these programs, they could call me directly at area code 636-949-7400, extension 6255. They could also visit our website. Parents are definitely our first teachers, and many of our hygiene practices we learn from parents. So just reminding their kiddos when are the good times to wash your hands. Always wash your hands after you use the restroom, before you eat, after you touch an animal. We do want them to use warm water while washing. They should be rinsing their hands with water first, then getting a generous amount of soap. And they should rub and scrub their hands for at least 20 seconds or about as much time as it would take them to say their ABCs.
Thanks, Brittany, for showing us a simple routine that stops the spread of germs. Preventing the spread of disease is the job of our medical community. Communicable disease nurse Shelley Reynolds will explain what's being done to stop tuberculosis. Shelley, welcome back to Safe and Sound. It's great to have you.
Thanks, Doug. I appreciate that.
What exactly is tuberculosis? How is it spread, and is it something that we should be concerned about?
Tuberculosis, or TB, is spread by a bacterium called Mycobacterium tuberculosis. TB generally affects the lungs, but it can affect other parts of the body, such as the brain, the spine, or other organs. TB is not spread by casual contact, such as handshaking, hugging, kissing, sharing eating utensils. Active TB is spread when an infected individual coughs, sings, or sneezes the bacterium into the air. And can it be dangerous? Yes, it can be deadly if not treated effectively. However, there are very effective cures for tuberculosis.
I heard you talk about active TB, but I've also heard of something called latent TB. Can you kind of give us an explanation as to what the difference is?
Absolutely. So not everybody that's infected with the TB bacterium will go on to develop active TB. There's two distinct conditions present. Latent TB infection, and that is when the individual is not sick, doesn't have symptoms, and isn't contagious to those around him or her. Active TB is when the body's immune system can't fight off or contain the bacterium anymore, and it progresses to active TB where they are contagious, they are symptomatic, and they can pass this disease to those that have prolonged close contact with them. Now, it's important to note that symptoms of active TB include such things as a cough lasting longer than 3 weeks, coughing up blood, chest pain, fever, night sweats, and I'm talking night sweats where you drench the sheets, not just a little sweaty at night. So those are some characteristic symptoms of active TB.
And are certain populations more prone to getting this disease?
Absolutely. You know, people may never progress from latent TB to active TB. It really depends on their immune system and how your immune system can contain or fight off the bacteria. But there are some individuals that are at higher risk of developing active TB or progressing from latent TB to active TB. And some examples of those individuals would be people that have a hit to their immune system, such as HIV, diabetes, individuals that have recently immigrated from a country where TB is endemic, children less than 5 that have a positive TB skin test. Of course, those individuals that have recently had prolonged close exposure to someone with active TB disease, alcohol abuse, illegal drug use, and also individuals and employees associated with congregate settings, such as Department of Corrections or homeless shelters.
And you mentioned those populations, and you also talked about a test. Is there somewhere here in St. Charles County that someone can get that test, and what does it involve?
No, it's a great question. So there's 2 kinds of tests that can detect the TB bacterium in your body. The TB skin test, and that is placed what we call intradermally, generally in the forearm, and then read by a qualified individual 48 to 72 hours to detect if there's a reaction or not. And then there's also a TB blood test. Now, of course, if either or both of these are positive, additional information will be warranted, such as a chest x-ray and a history and physical.
And I think probably people are more familiar with active TB cases and how that's treated. Is the treatment for latent TB the same as that, or are they different, and how would they differ?
There are some of the same antibiotics used for both latent and active. But if an individual is diagnosed with latent TB infection, and remember, that is with a positive test, a generally normal chest x-ray, no symptoms, not contagious, there is a recommended course of treatment that's 9 months of an antibiotic, and that is given in hopes of, and it's data driven, that it will prevent the body from progressing from latent to active TB.
And if someone wanted more information about this disease, they could obviously talk to their doctor, but are there some resources that you would recommend people go visit?
Yes, I think it's extremely important to stick to reputable sources, and I would strongly encourage anyone that wants additional information to speak to their primary care physician. If that's not appropriate, stick to the reputable websites such as cdc.gov or, of course, St. Charles County Health's website, which is health.sccmo.org. And on that website, an individual can review what we've talked about here today, as well as find contact information for the communicable disease staff within St. Charles County Health Department.
Thanks for coming in today, Shelley. Every time I talk to you, I learned a little bit more, even though it's kind of something that we don't necessarily want to know about.
Right.
Appreciate it.
You're welcome.
After this short break, we'll be learning about helping families in need and about preventing fires in our homes. Stay tuned.
How you doing? My name's Steve. My family's lived in this neighborhood for years. Recently, things got so tight, we had to go to our local food bank for help. I lost a lot of sleep worrying about what the neighbors might think. That is until I saw them there, too. How'd I do, Steve?
A little stiff. You could have done a little better.
What? Come on. You know, I have an Academy Award.
Yeah, but not for playing me.
Play a role in ending hunger. Visit feedingamerica.org/hunger and find your local food bank.
Welcome back to Safe and Sound. I'm your host, Doug Bolnick. On today's episode, we're visiting with community leaders about programs that keep us physically and mentally strong while also improving our community. One organization designed to help is the Community Council of St. Charles County. Dottie Castigar is here to discuss the Continuum of Care Coalition. Dottie, thank you so much for coming in.
Thank you.
Could you tell us a little bit about what the Continuum of Care is, and who you help, and what you try to do?
Sure. The Continuum of Care is part of a national effort to end chronic homelessness. And at the local level, the federal government asks us to bring together community stakeholders, nonprofit organizations, and interested citizens in the community to look at homelessness in our community and how we can end that. And so we're part of a larger effort, but our particular coalition is local.
And you mentioned a number of groups in our community are a part of this, but what kind of assistance do you give?
Well, the Continuum of Care looks at the whole range of services for people struggling with housing. So, for example, Salvation Army, that operates an emergency shelter, is one of the frontline organizations that someone might call if they're experiencing a housing crisis, because they can provide an emergency shelter. We provide the support for the nonprofits as they look at what they can provide and then where are the gaps in services. And then we work with community organizations to let the public know what those gaps are and ask for help in filling them.
And if an individual did think they might need some assistance, would they call you, or could they call any of the members, or how do they get help?
They could call any of the member organizations. The Salvation Army is probably not a bad place to start. On our website also, we have a community resource directory, so they could look online under homeless assistance and find out what the various organizations in our coalition provide and where they might fit. Some organizations might help with rental assistance over a period of time for someone's experienced a job loss. And then there's a range of services.
And if an organization hasn't yet joined the coalition, is there opportunities for them to join?
Absolutely. The coalition is open to the public. We meet the third Friday of each month in varying locations. And so anyone interested could call our office and get a copy of that schedule. And again, we just try to brainstorm solutions in our community to help people to stay safely housed.
And is there a way that individuals can help rather than just organizations?
Yes, individuals can help out with a lot of material assistance. Through their church, they can conduct blanket drives, clothing drives, help out with job searches for people struggling, and just talking with their pastors or community leaders about how does the church respond when they get a call for someone experiencing homelessness. Make sure their church is connected to the resources.
Well, thanks for what you do, Dottie. We appreciate you coming in today.
Thank you.
Fire departments around the United States respond to more than 300,000 home fires each year, and cooking is the leading cause of home fires or injuries. Assistant Chief Steve Brown from the Central County Fire Protection District offers some home fire prevention tips.
Well, actually, kitchen fires is the #1 cause of fires in homes in the United States, and we respond to them multiple times every month, specifically for kitchen fires. The #1 cause on home kitchen fires is unattended cooking. It is so easy to put something on the stove and get distracted. You know, maybe it's your neighbor knocking on the door selling fundraiser cards, or you get a phone call and you forget how long time has passed, and while the food is on the stove, then it catches fire, and then people panic. Every fire is different. There are different types of fires that we can have in the kitchen, and each one should be handled in its own separate way. The most common fire we have is the unattended cooking fire, especially with grease. When they're getting ready to fry chicken or vegetables or anything like that, a grease fire is very important to treat a specific way. And the reason is that grease, when it gets so hot that it catches fire, that if you would throw water on it, as soon as the water drops hit the grease, they explode in steam, and it causes the grease and the fire to explode all over the kitchen and all over you, which can be extremely dangerous. So the most common way and the easiest way to put out a grease fire is to take the lid to the pot and just carefully walk up to it, put the lid on it, and basically you remove the oxygen, which then the fire goes out. Also, once you put the lid on it, just move the pot off to the burner that you're not using, and that way it can cool down. Don't take the lid back off, because as soon as you do, it'll get oxygen and it'll catch fire again. The second most common fire we have in our kitchens is a stove fire. You know, after a whole year of baking and making different dishes, sometimes they boil over and debris ends up at the bottom of the stove. This always happens every year just before Thanksgiving. We'll get a ton of oven fires because people are wanting to clean their oven and get ready to bake that turkey. So if a fire should occur in the oven, the best thing to do is just leave the door closed. The fire will be contained inside the oven, it won't extend past the oven, and it'll eventually suffocate itself out. Both of these types of fires, if they should occur in your home, after you take this action, we do want you to call 911, because we want the fire department to respond just in case and check it out to make sure everything is okay, and then provide you with any assistance with removing smoke or any other problems in your home. Well, first of all, when you are cooking in the kitchen, make sure that you're not wearing loose-fitting clothing, robes, dresses, or anything that is loose and flowing, because as you're working over the stove, it could eventually catch the fire from the burner of the stove. Second thing, and this is the most importantly, especially with families that have small children, whenever you're cooking on the stove, always make sure that the handles are turned to the inside, away from the outside. Because little children who are always wanting to help mom or help dad in the kitchen, they come in and they see this and they're like, "Oh, Dad, I can help you," and they grab the pan. Well, whenever they do, they'll pull that down on top of them. One, causing a fire, also severely burning the child. So always just take a second, turn the handles in. The other reason why we ask you to do that is because as you're working around the kitchen, you can accidentally bump this, get your sleeve tangled in it, and it will fall over and catch you and the kitchen on fire also. Just never leave the kitchen if you're cooking. If you do have to leave to go answer the phone or to answer the door, take and remove the pan from the burner that you're using, you're basically removing the fuel from the fire. Or if you can, just turn off the burner and you're removing the heat. That way, if the conversation at the door or on the phone takes a little longer, you won't have an unintended fire. Every home should at least have one fire extinguisher, and we recommend that you have that extinguisher mounted or posted at a point where you're exiting the home. In most residential homes, we put that in the garage, right outside the door through the garage. That way, as you're leaving, if the fire is getting too big and as you're leaving, you can get out safely. Or if it's a small fire and you want to use your extinguisher, you go to the door and you get the extinguisher and you come back and you can try to extinguish the fire. Always putting yourself between the fire and your exit so you can get out of the home safely. Always call the fire department. We're more than happy to come and the fire be out and just provide any assistance that we can to you. Sometimes the homeowner will be concerned that the fire has extended into the cabinets. We have infrared cameras that can check to make sure that the fire has not extended. If there's damage to the appliance or to the microwave, we can assist you with disconnecting the power, making sure that that's safe, and then again, ventilating your home and getting the smoke out so it doesn't stain or cause a problem. If you have any questions at all, feel free to contact your local fire department or Central County Fire Rescue at 636-970-9700 or our website at centralcountyfire.org. There's lots of useful fire safety information there.
We've discussed a number of ways that groups are making our community better on this episode, but that's all the time we have for today. Please join us next time to learn ways to help keep your family safe and sound.